Hi, everyone. I'm Jenny Rudeski. I'm a developmental behavioral pediatrician here at Michigan Medicine CS Mott Children's Hospital, and I'll be your host for today's live stream. Today's topic is back to school. This back to school season is unlike any other, as families are making decisions about sending their children back to school in person, trying to navigate how to support their child's remote learning from home. We know that many families have a lot of anxiety about starting the school year during a pandemic. And so we are hoping to answer some of your questions today. I'm joined by our experts. We have Dr. Sheila Marcus from Child and Adolescent Psychiatry, Dr. Melissa Cousineau from Child Psychology, and Dr. Allison Tribble from Pediatric Infectious Disease. This is a great combination of women who will be able to answer questions ranging from mental health, coping with stresses and uncertainty, and how to minimize infection risk while still giving our kids the social interactions and experiences they need. So out of respect for social distancing, we're going to be doing this live stream remotely, as you can see. So please have patience with us if we have any technical glitches or interruptions. So first, a few housekeeping items. You can submit questions at any time, even right now, for our panel to answer during the Q&A portion of today's chat. Questions can be submitted by commenting on this video, but please note that your name or profile name will be visible to others participating. If you prefer a more anonymous option, you can send a private message to us via Facebook or email us at ask-mishmed, that's ask-michmed at med.umich.edu. That's ask-mishmed at med.umich.edu. If you can't stay for the whole chat, or you want to share the recording with a friend, a video of the chat in its entirety will be available on our Michigan Medicine CS Mott Children's Hospital Facebook page, our @UMichMedicine and @Mott Children Twitter account, and the Michigan Medicine YouTube channel. Okay, so let's move on to our questions. The first one we're going to start with is probably what we're all experiencing with the past week or 2 weeks if your child has already started school, or for those of us in Ann Arbor next week. So the first question is, most parents aren't educators. How can we ensure children are getting both the educational and emotional growth they need during this time? Should parents be considering supplements, supplementing their education depending on their child's age and developmental level? So I'll start with Dr. Cousineau. What other things can we do as parents to make sure kids are getting some degree of good educational experience, even though it's not going to be what they usually have?
Sure, this is a great question. And to all the parents tuning in today, I think we all, as parents ourselves, want to say you are doing a great job and this is really hard. So, as we continue to answer these questions, know that that is driving all of this. So a few quick points related to this question. So one thing I like to keep reminding myself and that I'm telling parents and children that I'm working with is that children are still learning. So learning might look differently, but they are learning. They are learning about kindness. They are learning about working together with their community. They're learning about flexibility. They're learning problem solving. They're learning about resiliency. And these are values and these are skills that we know are hugely predictive of future successes. And so when, as a parent, you're feeling stressed about math and reading and all of these things, I think it's helpful to remind yourself that even during a pandemic, children are learning many, many new things that they have never faced before. And that is important. Secondly, our educators, they have been working so very hard. So thank you to all of our incredible educators who have been designing new and novel curriculums and thinking about different ways to reach children this fall with a lot more time to prepare than they did in the spring. And so we expect school to look differently this fall. And so, when you're feeling stressed about supplements, I would really encourage parents to let go of that. For those of you that joined our Thrive with the Family series in the spring, I talk a lot about juggling balls, and I would say supplements should be a rubber ball. It's not one of your glass balls. So I think, our school systems are working to make sure children are still learning in terms of academics. And if you are going to supplement, I would encourage it to be things that promote wellness and resilience. So supplement with things like helping your child implement a gratitude journal, help your child or your teen find a new hobby, bake apple goods this fall and deliver them to friends and families and neighbors. So think about supplementing in terms of emotional development and resilience, as opposed to putting that stress on you and your child related to school. So those are kind of 3 points I keep reminding myself as a parent.
That's great advice. And I think I agree that keeping it about life skills and emotional wellness, not about, needing to download 5 new apps that all, teach math skills or other things like that, really is a good mindset. And we'll also talk a little bit later. I know there's some questions about if you have a child with special education needs or developmental delay, what sort of supplements can you be adding on in terms of outpatient therapies if your child can't get those one-on-one in school because of virtual learning. So next question is mentally, how can I support my kids as they start a big milestone? So some kids are entering kindergarten this year, some are entering middle school or high school. So these always feel like life milestones, but now it's happening virtually. So Dr. Marcus, I'm wondering if you have some ideas about ways to support kids and not just make it feel like any other Zoom call.
Sure. Well, another great question. And to begin, I think whatever the milestone, whether it's kindergarten or high school, for all people, there's a lot of what we call anticipatory anxiety, which is worrying about something in the future before it happens. And so normalizing that for kids of all ages to say, it's pretty typical to have some butterflies before a big thing. And in general, to label the emotion, this is what you might be feeling. Here's how I manage it. These are some things that I do when something big is coming up. And little things like grounding yourself, taking a breath, teaching kids the 5, 4, 3, 2, 1. So see 5 things in the environment, touch 4 things in the environment, let's see, smell 3 things, taste, 2 things, etc. And that is a way of simply grounding yourself in the moment, and I think helps. We have an anecdote that we say that whenever you're dealing with somebody who might be having some anxiety, the first person in the room whose anxiety you have to manage is your own. So make sure you yourself are grounded before you help your kids. So the other things that we say around anticipation is to just rehearse things a little bit. So if you have a child who might be socially anxious, to figure out a way that they might meet their teacher, whether it's, on a Zoom format or whether there's a social distancing way that they could meet the teacher or meet some of the kids in their classes. And I would imagine many schools will be doing something like this. And the other things are to just prepare in the way that you would be preparing for any other big milestone. So going out and buying some special things and getting the new shoes and getting your environment set up in a way that's comfortable, and just sort of mentally rehearsing and physically rehearsing what that day might look like. We're going to get up. Here's where your school space is going to be. The kids can help you if they're younger with labeling what that might look like, with having the tools that they need, in terms of pens, paper, etc., passwords to get into their Zoom meeting, and all of those things I think can help them.
Yeah, we just reorganized bedrooms in our house this weekend, and it was so refreshing to be like, what's my space going to be for, if virtual learning continues for a long time, how can we reorganize the space so it doesn't just feel like any other day? And getting children's collaboration and contribution to those setups, our kids drew out little room plans, just so they felt some ownership over it. And it doesn't feel like you as the parent with that anticipatory anxiety are controlling their entry into this big milestone, but that they have a big role in it. All right, I'm going to direct the next one to Dr. Tribble, because I want to, we've all been talking about that kind of emotional preparation side, but there's a side of this for families whose kids are going to be attending in person. or who are not attending in person but have pods, of like kids who might be neighbors, they might be friends, and they are sitting together and trying to learn together. What are your thoughts on whether this is safe? What steps should people take to make this, as low risk as possible, to feel comfortable with the fact that they're giving their kids the social and learning interaction as a collective group, but also, more face-to-face contact than they otherwise would have?
Yeah, I think I've certainly been hearing the question over and over again, is it safe? And I think that's obviously a very natural question for everyone to be asking, but it's not a really straightforward question because the definition of safe is going to be different for every family and every situation. And so it's really about, like you said, low risk. It's about assessing the risk and the benefit of given situations and making a decision and a judgment for yourself about this is the right fit for us. We're willing to accept this level of risk because of the benefit that we'll get that comes along with that. So I think, and many of the mitigation measures that we talk about using to, control the spread of the coronavirus, things like wearing masks, social distancing, cohorting, whether it's in person school or with families, out in the community, hand hygiene, doing activities outdoors. All of these are great ways that you can lower that risk of the virus spreading. And each one, none of them is perfect by itself, but each one adds another layer of protection. And so you can think about, maybe I'm going to give up a little bit of risk because I want my kids to have a little bit of interaction with some people, but I'm going to limit the number of people that they're interacting with. And if you limit that to maybe say households instead of a bunch of different kids, maybe you have a similar family with similar aged kids, and so the siblings can all play together, then you're only mixing 1 or 2 households or 3 households rather than mixing, say, 6, 7, or 8 households. So those kind of, the amount of exposure that you have to people who are doing different things, the more that you increase that, the more you're going to increase your risk of having the virus come home to your house. But you can take some small steps to increase the amount of time that your kids can be around other people and have some social interaction, by layering on different measures of protection.
And also, just, I guess, on top of that is the communication with other parents, that you all are doing those levels of protection, that there's not this pressure or judgment when we're talking to other parents about, oh, did you go to the movies last weekend? And other things that might change their risk level. I think just being calm and open-minded with other parents will help reduce that anxiety. So this is kind of a question for all of you, because it has both to do with anxiety, but also about mask wearing and adding different layers of protection, like Dr. Tribble just talked about. So this question was, my children go to small schools and are required to wear a mask all day. I'm still very nervous about sending them. Should I be doing anything else to keep them safe? So I guess the questions here, we could start with Dr. Tribble, just to add on to what you just said about hand washing and outdoor play and other things. When kids are actually going to go to a school every day, 5 days a week, with smaller class sizes, maybe more distance between desks, and the schools will do things like cohorting, where they are just with certain kids. They're not all going into the cafeteria together. What else could parents be doing on the parent side to keep them safe? And then for after you're done, maybe Dr. Kuzina and Marcus could talk about, what about our nervousness? What about our anxiety as parents, letting our kids go back when they've been in our homes for months now and feeling okay with that unknown of sending kids into a slightly higher risk situation?
Yeah, those are all really good questions. And thank you for, I agree also with, like you said, about a lot of open communication with their families, because that's really important too, knowing what the other risk of the people that you're around is. So as far as, kids who are actually going to school, and I actually, from my own experience, my kids are actually doing this because my kids go to a Catholic school here in Ann Arbor that's open. And so I've had a lot of firsthand experience with, they actually started last week. So, and we are doing things like all the kids are wearing masks, the desks are spaced apart. There's actually plexiglass dividers between the desks. There's no mixing between the homerooms. They're eating at their desks, they're trying to do outdoor classes, gym is outdoors, et cetera. There's all kinds of things that the school has put into place, and they really have a really strong plan. And I think the first thing I would say is know what your school is planning to do. The school, I'm sure, is going to communicate with you, but, really being aware of what measures are already in place. And you might, maybe you'll see if there's some gaps that concern you. You can talk to the school about whether that's a concern. I think, teaching your kids basic preventative measures at home and modeling those for them so that when they go to school, it's second nature. Things like making sure they wash their hands before and after they eat, when they touch their face, or using hand sanitizer, modeling wearing a mask at home, practice at home so that it's not the first time when they're going to school, and do it for a while so they get used to wearing it for a couple hours. Teaching them to cough into a tissue or into their elbow. We call them cough pockets. Cough into your elbow and, wash your hands after you do that. So those kinds of things are really important for parents to teach their kids so that when they go into school, the behavior is already there and the teachers can reinforce it. I think limiting exposures outside of the classroom, our school has asked us to, not mix with kids who are not in other classes. And obviously that's not always possible, but, to the extent that you can, doing what you can outside of school to limit the chance of COVID coming into the school, that's going to help everybody stay safer in the school. It's going to help the school stay open. So I think that's really important too. And, assessing your own risk in your own family and determining what is, really the right thing for your family is going to be really important.
Yeah, and like Dr. Tribble, I have young kids, and they're actually back to a childcare setting after being home with us for some time. And so I share those worries, those sleepless nights that parents are having after having your kids home for so long, and thinking about taking this next step in terms of risk exposure. But similarly, felt really comfortable in the mitigation strategies that were being used. And also, I think that there's this pyramid of need that each family has to figure out for themselves. And as a child psychologist, I've never been busier, and having my kids home was something we could not continue to do. And so with the appropriate mitigation strategies in place, you started tiptoeing into that cold pool, and eventually we're in there and it's okay, and it's feeling safe and it's feeling comfortable, and just continuing to check in with my child care owner, the small group of parents that are there. We've created this pod in a sense, and it's really been really good for my kids and for my families. And so I just kind of continued to focus on what was within our control and what was without of our control in terms of managing my own anxiety. It was outside of my control that, like, we needed childcare, like that had to happen for my family. And so focusing on what was in our control. And so making sure that we're doing those mitigation strategies when I'm feeling anxious and nervous. What can I do to distract myself, to cope, to seek help from others, to call many of my friends and talk about it. And so many parents are with you in terms of these worries, and just continue to make sure that we're doing those things, those layers to support our kids and ourselves as we make these steps forward.
Those are great suggestions. The other thing that we sometimes talk about is being a detective with your child. So asking simple questions, laying it on the table. Bud, I know lots of kids are a little bit worried. We've been together here all summer. Do you have any worries about going back to school? And then just listen. Not talking about it with your child is much bigger than actually talking about it, because when these things aren't talked about, kids can have in their heads all kinds of. Children are by nature very narcissistic. They tend to blame themselves a lot for things that are not their issue. And so hearing what they have to say and making sure that the reality that the grown-ups are doing all of these things to try to keep you safe. That if somebody gets sick at your school, it won't be your fault, but everybody's trying hard, to do these kinds of things is huge. So I think that is also a really important thing, is to sort of put it on the table in terms of, what it is we're doing, and not to channel your own anxiety, right? It's possible to sort of say, I think you're going to be okay. I hope so. Have a good day. I love you, which channels the plane might actually be going down. So you want to really be careful about your own tone with your kids as you send them off.
And I think that detective analogy is also really important as they go through the school year. Things are going to change. We're going to have to make adjustments, and we're going to have to be open to listening and observing about what our kids' inner experiences are here, because, right, many of them may not, they may be the type who internalize and try and keep it all inside and think it through or use their imagination to solve it. And so they need a chance to express that. And you also may be surprised by what your kids, how they respond, right? When we sent our kids to a socially distanced soccer camp over the summer, I was like nervous sitting at home, like what's going to happen? They were so happy when they got home. They were not anxious. They really surprised me at how they responded to it. And I think it was very helpful for me then to see how they were responding to these new challenges. And it reassured me as a parent, that they have some coping strategies that they're using. Let's flip now away from being in person all the time to another parent asked if there's a face-to-face versus virtual option, and I choose all virtual, which a lot of families are doing. What can I do to make sure my child is not left behind, so to speak, not just with schoolwork, but with friends socially too? So another related question was, my kids aged 5 and 7 are home until at least January, and I wonder how not being around other kids will affect them. So Dr. Kuzno and Marcus, could we talk about, the impact of kind of being in a child's social environment versus not, as well as how can you try to replicate a little bit of that, in the socially distant ways that still keep us safe, but are also, meeting those needs that we as parents can't always fill.
Mm-hmm. Well, first to know that children by nature are fairly resilient. So having 6 months or a year where you're doing distance learning rather than in-person learning is frankly very unlikely to fundamentally change their developmental trajectory. So you can simply be reassured about that. Number two, there are families who have chosen before COVID to homeschool their children. And they tend to choose other ways in which their children get social experiences after the school day. And again, in this world, that's going to be with a select number of children who you are comfortable with, whose families are perhaps doing similar mitigation strategies. But you can do modest after school kinds of activities. And those would be certainly things that would be reasonable. In addition, all children get lots and lots of socialization from their siblings, if they have siblings, and from their parents. The relationship with parents, frankly, is what we call the secret sauce. That is the thing that sets children up for success, for cognitive success, for success with intimate relationships. So don't discount the relationship that you have with your children.
Yeah, and I would add, I think that there's ways we can continue to think about promoting socialization in new and different ways. So, this is a really good time for kids to think about special surprises or cards and drop those off at friends' houses or old neighbors' houses. This is a good time to look back through old pictures and say, we haven't connected with that friend in a long time. We've been so wrapped up in basketball or soccer or fifth grade that we haven't touched base with our old neighbor that we really love to get together. And why don't we call them or set up a Zoom? And so I think encouraging some of those new and novel connections is really good. And I would just echo, what Dr. Marcus was saying about the resiliency of children. As a pediatric psychologist, I work primarily with kids who have chronic critical medical conditions. And some of the patients I work with spend months to a year in the hospital. And so they are not in school. They are not participating in their extracurriculars, seeing friends in very limited ways. And, while those moments are hard and they certainly benefit from support and intervention, they go on to be resilient and successful and wonderful, children and teens and adults. And so I too take a lot of stock in that, in the resiliency of our kids, and remind myself of that, that I think kids will continue to thrive with the right supports in place.
There's also something I think about the world being a little bit quieter now, and that if you think about how busy all of us were before all of this and running frenetically about, that our relationships in some ways were a mile wide and an inch deep. And I do think there's something about having a fewer number of people and activities that allows you to have deeper conversations. And it's a different kind, but a very important kind of a social skill to develop.
And I think I love those, new ideas about ways to interact with neighbors or loved ones in novel ways. This is an opportunity to be creative about new ways of, part of social interaction. What are the important ingredients? They are thinking about someone else, thinking about someone else's mind, developing that empathy. That's like, how's that person doing? What do they need right now? How could my actions impact them and fill their bucket, as we talk about with, bucket fillers. And that could be, friends that they see in school. It could also be neighbors and other loved ones. I've gotten a lot of questions about, is this the time to give all kids a social media account then so that they can interact that way? And I think we could be more creative than that. I don't think you need to jump to social media if your kids aren't ready for it. I think, we've tried with my almost 11-year-old. Could we plan out some Zoom meetings or some Google Hangouts or FaceTimes or whatever with a few friends that we schedule, and we intentionally try and find some time that he can connect with them if they're all virtual. And those might be good learning opportunities to get your kids using a very contingent, meaning I watch you, you watch me. In the moment, we're responding to one another and we're thinking about each other, way of socializing through video chat, which is much more, works on those social skills much more than I'm going to post this and you're going to like it. And then you might post something and I don't understand it. There's so much that's lost in just, posting stuff on social media. It's much better to have that really synchronous interaction. We just got a couple new questions from folks on the live stream. So I want to ask a couple of those. One of them kind of picks up on what Dr. Tribble was talking about, that when in-person schooling is involving all of these changes. So we got masks on all the time if kids can tolerate them. We have plexiglass dividers. We have more space between kids. They're not, getting in each other's physical space as much, or hunching together around a comic book or other things that are part of our sense experience of the world. So this viewer was asking, could these steps stress kids out? When we're putting a little bit more distance physically from each other, is that somehow changing their social development? And is this, I think this is a really hard question. Is this more beneficial than virtual learning if they can't interact or see facial expressions all day? That's a really hard, and again, I think I'd go back to what Dr. Tribble was saying with risks and benefits, is that even with a mask on, you can see your eyes. Your eyes show so much of emotion. You have so many muscles around your eyes that are constantly moving. My family and I went for a hike the other day. We were wearing masks because it was, we were passing by other families, and it was a pretty tight trail. And we were playing this game, like, can you tell what I'm thinking just based on what my eyes are showing? And we were pretty good. It wasn't as easy as just with your whole face, but I think you can still get a lot of body language without being able to see people's mouths. But I want to hand it back to Dr. Tribble to talk, as well as the others, about the kind of risk-benefit ratio of distancing versus not having the same type or flavor of social interaction.
Yeah, it is. It's for sure, even kids who are going back to in-person school, it's for sure a different experience for them this year. And, that was something that I wondered about. How would my kids respond? Would it be weird for them? Actually, the first day my sixth grader came home and said, I couldn't see the board today because I was looking through 3 layers of plexiglass. And so, but, I talked to his teacher and she was like, oh, maybe I'll just, angle the desks a little bit. So I think in some ways it's, continuing to teach us to be flexible and resilient and to, embrace new things and just adapt. And that's kind of what I've been telling my kids, is that, it's going to be different, but, we're going to figure it out. And we're going to do all these things because you guys want to be in school and you want to be able to learn from your teachers in person and see your friends in some way. And so, yeah, if that means you have to wear a mask all day, well, that might, I think all my kids feel like that's still better than not getting to see my friends at all. And so, but I think it really is going to vary from family to family if that's really the right thing, because it is different. But I think, from one of the things that my kids definitely benefit from is the structure, especially the younger kids. I think, that's something with 2 working parents and 3 kids, plus during the lockdown, we had a toddler at home. We were not able to provide that school structure for them. And so for the younger kids, that was really a hard problem for us. And we were not able to really educate our kindergartner at home at all last year. So again, I think these things are really, just case by case, same thing. We don't have a very high risk health condition person in our family. We're not seeing grandparents frequently. So, for us, if we were to have the virus come into our house, I think the risk to our family is relatively low. And so, to us, the benefits of our kids, even if it's in a weird way, being in school, definitely outweighed keeping them home. But, it is really something that every family has to look at because there's so many different sides of this.
Yeah, and I think as we've been talking about, I think if we spend some time with our kids and give them some information about what to expect, how school might look different, help explain why we're doing these things, why they're being asked to wear masks, why they're not switching in between classes, why they're spread out during recess, help them understand it and explain what it is. It's certainly, as Dr. Marcus was saying earlier, the unknown can often be a lot more scarier and confusing. So just giving them some anticipatory guidance about what to expect, seeing how they feel about it and helping them problem solve as it relates to that. We recently went to the zoo for the first time this weekend. And, I talked with my 3-year-old about it. We're going to go, but we're going to have to wear a mask the whole time. How do you feel? No big deal to her. The kids at the zoo just overwhelmed me with how wonderful they were doing at wearing their masks and experiencing the zoo. And so I think checking in with your kid about it, letting them know what to expect can certainly help, and making sure that they have that space to continue to come to you with new worries or new challenges as the year progresses.
I think also sort of channeling this idea that we're all doing the best that we can, that this is what the grown-ups have decided, and it seems to be working well. But also, when I've talked about this before, the notion of a repair, that we may not get it exactly right the first time. There might be 4 layers of plexiglass between you and the board, and you're not going to be able to learn that way. So we'll fix it. That teaches kids, number one, that the world is not perfect, which of course it is not. And number 2, that if grown-ups get it wrong, they will hopefully try to fix it, which means that if I get it wrong, the world will be forgiving with me and I can help fix it as well. So all of those are really important life lessons.
All right, great. Well, we have a couple of questions related to children with underlying health conditions. So this will probably be for all of you. And now I'm scrolling down to figure out exactly where I found them. Okay, here we go. Are children with underlying conditions, such as heart conditions, at higher risk for COVID? Will they have a harder time recovering, or do we not have enough research yet? So Dr. Tribble, I wonder if you'd take that one.
Sure. Certainly heart disease in children is not the same as heart disease in adults. So I think, there's been a lot in the media about adults with heart disease being at high risk for complications from COVID, and that's certainly true. I think it is true that we don't have that much information yet about kids with heart disease. I think, in many ways, I would think, in the absence of knowing a lot about this virus and how it's going to impact kids, we can think a lot about other respiratory viruses. And so, if your child is a child that would be high risk if they got any respiratory virus, then I think certainly this is another virus that could be hard for them to handle. If your child has a relatively mild heart condition, then it may not be a tremendously increased risk for them. Certainly talking to your cardiologist and your pediatrician who knows your child's situation is going to be the best way to go. And understanding that, we're learning about this disease every day. And so, we may not have the best answer right now. We'll do the best we can, but, check back because things may change. And I think that's, kind of the same advice I would give any family who has a kid with an underlying disease. I think the good thing is we're not seeing in general, really severe disease in kids and, even in kids who do have underlying diseases. So there's nothing to say that, there's no one population that's come out so far to say, gosh, this is a really high risk pediatric population. I think a lot of it is just more common sense and taking knowledge from what we know about other viral diseases at this point in time.
There was another question about hearing in the media that mask use may not be safe for children with asthma or other breathing issues. Is it safe for children with breathing issues like asthma to wear masks all day?
Yeah, so I can definitely talk about that as well. So it is actually completely safe for kids to wear masks. It's safe for adults to wear masks. If your child has asthma, generally their symptoms are likely, well controlled. Otherwise, they're not going to school anyway. So if your child is breathing fine and going to school like they would normally, it's completely safe for them to wear a mask. There's as an example, surgeons in the OR wear masks for many, 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 many hours. And we've done that for many years, and we've never had any trouble with that. There's no evidence that they get less oxygen or that carbon dioxide builds up. Those particles are very tiny and pass through and around the masks without problem. So there's really no risk. The only thing, would just to be careful if, your child is having an exacerbation of their asthma and is having trouble breathing in general. Wearing a mask might make that more difficult, but at that point, you're probably doing other things to take care of that for your child. They're probably not going to school anyway. So I think that in the general setting, kids with asthma should have no problem wearing masks. And in fact, it might actually be more protective for them. They may actually be more protected from viruses which can exacerbate their asthma. They'll be protected from some pollutants and pollen and allergens and things that can also exacerbate their asthma. So it may actually help them more than it would even hurt them.
And I think just a take-home message about what we see on the media or what we see online. There's been so much COVID-related misinformation or bad information on social media, on different websites. So it has really been a challenge for doctors, for patients to identify what's real. Things are moving so fast. A lot of things like mask wearing have become political issues, and social media feeds are programmed to elevate the things that rile us up the most or that make us most emotional, or you may be sitting there wishing, I wish this would just be over, and you may feel like you want to click on that thing that article that's giving you the promise that this is all fake. And this is, I'm amazed to see some of the stuff that's on social media and is allowed to stay up. So be a conscious consumer in terms of, if you read something and it sounds either too good to be true, or it sounds a bit like it's, just trying to be a bit like clickbait, look for that same information in other places. Have a couple different news channels that you focus on that might be local in Michigan, they might be national or international, and see if you're saying the same information in multiple places. Have an open conversation with someone you love about it, rather than just posting it and having an argument about it on social media, because these are important day-to-day decisions we're making, and we want to be savvy, because people know we're upset right now, and so they're posting things that gets our attention. I wanted to ask one more follow-up question about people with masks and chronic health conditions, because one audience question was, my child's in elementary school where masks are not required, but we'd like our child to still wear a mask because of the vulnerability of me, the parent, and their spouse at home. Do you think this will help if other children aren't wearing masks? And I think that a follow-up question from another audience member was, for children who have high-risk parents, how else can you limit risk or exposure? So two things there. Does your child, being the only child wearing a mask, is that worth it? And then what other things can families do? If there's someone at home, if you have a grandparent at home, you have a parent with an underlying medical condition.
Sure. So in terms of, does wearing a mask protect you even if no one else is wearing a mask? Yes, it does offer some level of protection. We think that the mask wearing offers a greater level of protection for other people. And when we're talking about cloth masks here that we're wearing at home and in school. There's going to be more protection from spread if everybody's wearing them and we're actually keeping the germs inside the mask and not spreading them around. But the cloth masks do still prevent some of those germs from getting to you. They also keep you from touching your face, hopefully. I mean, with little kids, you have to be careful that they're not playing with their mask. But, in general, it's going to keep you from putting your fingers in your mouth, putting your fingers in your nose, which are ways that we get the virus into our body. So yes, I think that would be a perfectly reasonable thing to do, is to have your child wear a mask, even if the whole class isn't wearing a mask. And then, Dr. Rudeski, remind me what the second half of that question was about.
If parents are at higher risk, what other things can they do to help their child who's attending school or is exposed to other kids? What other things can they do to try to keep things safe? There was also another question about a ninth grader who's attending school in person, wearing a mask all day, taking a shower, washing clothes when they come home. But then other folks at home are all doing distance learning. So how do you mix those that are attending school versus those that are pretty much only staying at home? And what sort of precautions do we have to take when those folks at home are healthy or have underlying health conditions that might put them at higher risk of COVID complications?
Yeah, and I think in general, I mean, thinking about what the risk is to your family, the higher risk anyone in your house is, the more precautions you're going to want to take. So I think you can, and then you can kind of select these different precautions and kind of layer them on the more you think you need to do. And at some point, if you think no matter what the risk is too high, then you keep your kids home. I think that's kind of how I would think about it. So, if you have a kid who's wearing a mask in school or isn't wearing a mask at school and there are family members at home who might be at risk, I mean, certainly having them when they come in the house, first thing they do is wash their hands. Some people have kids change clothes, although it's really, the virus isn't really going to be carried on clothes. So I don't think that's quite as important. It's just really washing your hands when you get home. If you have a mask that you wore all day at school, just take it off right away. We have a little bucket by our door where we put all of our dirty masks when the kids come home so that they can be washed. Just kind of keeping things contained from school. If there's someone that's really high risk, you can have kids wear masks at home. I mean, that would be a lot to ask all the time, but maybe there's a short period of time where there's a high risk person visiting or something where you need to really keep them protected. So you can wear masks in the house if you need to really protect someone. I mean, I think the important thing to remember is that all of these measures are really targeted at people who are asymptomatic. So the first thing to remember is that if anyone has symptoms, they need to be isolated. They need to be away from people. And what all of these measures are trying to do is to prevent spread from people who are either asymptomatic or who have not yet developed their symptoms and are in the first couple of days of their infection. So we're not talking about, the kids got a runny nose and they're coughing. I mean, that's a much different situation. And so, it's really that I know there's been a lot of discussion about how there are asymptomatic people. At the same time, while yes, a somewhat, substantial portion of people who have this coronavirus infection will have minimal to no symptoms, that's still a very small percent of the population. So the chance that your child is asymptomatic, especially if you live in like we are in southeastern Michigan, especially in Washington County, in a fairly low level of community transmission right now, the chance that your child has asymptomatic infection is pretty low. And we know from surveillance testing of preoperative kids here. And actually, there was a recent study published looking at 28 different children's hospitals across the country, where the rate of asymptomatic infection was on average about 0.6%. So that's less than 1 in 100 kids. So, I think that can also help us to keep this in context. That's what we're trying to, prevent. So like I say, in my kids' school, 300 to 400 kids, there's maybe 3 to 4 kids there a day who might be carrying the infection that we don't know about. And that's what all of these measures are trying to prevent the spread of. So I think just keep that in mind too. But if that's really important, that you just can't take that chance, that there's a very small chance that your kid is bringing it home, then you can do other things like isolating them, having them use a different bathroom, sleep in a different bedroom. Obviously, don't share utensils and things like that, washing their dishes and their, cups and utensils right away, wearing masks in the house. Those are other things that you can do to prevent the spread within the house.
And I think
it relates to some of these questions too. I want to just add, there's actually, so the Pediatric Infectious Diseases Society came out for got a guideline statement for our pediatric transplant patients. So, the question about heart patients or some other children with chronic medical conditions about going back to school, or even their siblings going back to school. It was a really nicely done guidelines paper from a number of infectious disease specialists like Dr. Tribble that talks about kind of all of these different considerations and things that they may do in the school differently or in the home differently. And it's freely available. So parents tuning in with a child that may be moderate risk or high risk, this might be a really good resource to then also, of course, talk about with your medical team as well, but addresses a number of these kind of questions and comments that we're hearing from your families.
That's great. And I really like also your point, Dr. Tribble, about keeping track of what the community spread is, because if it's relatively low, then you can reassure yourself. Like there was another question about a child with immune deficiency or other chronic conditions, not knowing whether they should be playing with neighborhood kids. And I think that you following the levels in our community, it helps you feel more reassured that it's, 99 out of 100 kids who come over likely won't, and having open communication with other families about the child's exposures, maybe, stopping play dates the week after they were just on a vacation or seeing other people or went to a gathering, that you can kind of modulate it over time based on what's going on in the community.
Yes, and the only thing in that study that actually was associated with changes in the asymptomatic prevalence of infection was the community rate. So that is really, really important.
That's great.
I think the community rate, and also just every family understanding that there are certain high risk events, some of which you may choose to do, moderate risk events, low risk events. But so I'm an older person. Would I go to a bar? I would not right now. Would I go to Costco? I would not right now. Would I travel on a plane to see a newborn grandchild? I might. So you're sort of trying to decide which are the high risk events that you as an individual or as a family are willing to do. And you don't want to pile up too many of them, right? So after you've traveled, you probably won't be in touch with as many people. So.
I think I want to get to a couple questions we have about kids with special learning needs. Just, knowing that we have about 13 minutes left, and this has been, I wish we could stay on for 2 hours because this has been really helpful. I think a lot of families, we know in the US, 13% of kids are on IEPs. Those are special ed plans that mean they have a different learning style, they have a different way of seeing the world or processing information. So a lot of our patients have been struggling with distance learning. So one question is, could you offer tips to families of children with special needs like ADHD or learning challenges who usually rely on special services at school or may have individualized learning plans? How to navigate the remote learning setting, including how to keep them engaged in learning outside of the provided curriculum. I'm going to start a little bit, but anyone else join in if you have ideas. What I've been recommending to my patients is, number one, a lot of communication with the teacher, with the special ed team beforehand and ongoing. Knowing some of my patients are doing great with the engaging through a screen, others are not. And advocating for some sort of in-person sessions, if that's possible, given the community rates and given what the school can provide. We're all kind of making this up as we go, using best practices, but it's always worth asking if the child could get a little bit more support, or maybe could get a one-on-one virtual meeting with their reading instructor or with a special ed teacher more frequently. Number two is keeping in touch with outpatient therapists if you have them, or even starting outpatient therapy. It could be virtual, it could be in person, because that sort of supplement to life skills learning self-regulation, learning flexibility, frustration tolerance. Those are all really crucial parts of handling a curriculum that isn't clicking with your child. But they also can help you as a parent. I know a lot of parents are saying they just won't do the work. There's so much defiance cropping up because kids don't want to engage in school this way. So getting a therapist can help coach you on how to, have either, some visuals, a positive behavioral reinforcement plan, working with your child to, help them have more of a say in what they're going to do and when. Are all really, really important. And I have some families who, have kids with autism who are deciding to do a lot of ABA right now and just doing as much virtual learning as the child can engage with, but really, doubling down on the outpatient therapies because it's what the child can get one-on-one or in person. And I think all of those mix of approaches is fine. And I think there's also questions about what can kids with ADHD, what if they can't pay attention to a screen? What if they just hop on the screen and want to play a video game? Those have all been really difficult things to navigate. And again, having a plan ahead of time with your child, like this is your play time on your screen. This is the time for learning. This is the time for talking to your friend. Planning that out ahead of time, getting the child's input, making a schedule so it's predictable day to day. So they're not negotiating for extra minutes of time. are all important ways to just lay down a routine and a plan. Any other ideas about folks like making sure that kids with special learning needs are, getting their needs met right now?
I think those were all great, Jenny. I think that, consulting with your learning specialist first and going back to the IEP, don't forgetting the simple stuff. So a child with ADHD, for instance, is going to need a quieter environment. You may be able to plop one child in the middle of the kitchen, and that's a fine study space. For another child, it won't be. In general, for children with short attention spans, shorter is better. That may be a 10 or 15-minute period, and then a period of exercise, literally running around the backyard or doing something. So very frequent breaks are helpful. Sometimes kids who have attentional difficulties also are very kinesthetic learners. I remember my youngest child who had some attentional symptoms, who is now actually a pediatrician, so he ultimately did fine. But one of his teachers came to me and said, he's always fussing around with stuff on his desk. He's not listening. And I said, the only way he can listen is when he's fussing around with stuff on his desk. That's how he learns. So, and don't forget again that parents know their children pretty well. So in some ways, being able to see the world through your child's eyes and knowing, for instance, for an autistic child, a certain kind of a sensory environment is going to be a huge problem for them. And so you need to create this kind of space. So using things like their weighted blankets or, being in a chair that rocks or other things like that may be helpful for any given child.
Yeah, and I would add for all parents and all children, both those with learning challenges, but those adjusting to virtual learning. I think that as a parent, if you're working nearby and you hear them not paying attention or they're on that video game, it's easier for us to address that and to pay attention to that. And so as parents working around them or caregivers nearby, trying to focus on the times when they are attending, when they are learning, and giving them a nod and nudge, like really helping to highlight that, I think will be important for promoting that behavior. So, maybe you've got a little post-it note on that desk or that workspace, and when you walk by and you notice that they've got their camera on and they're paying attention and they're doing their math work, you're giving them a sticker and you're really attending to that. And so that we're not only catching them during those times that they're distracted or they're not attending, that'll really help to promote their learning about how we learn during this virtual world.
And I'm getting a lot of questions about screens, and are we know this isn't a perfect way to engage kids with their classrooms, right? You can't replicate that feeling of sitting in circle time or the feeling of watching what other kids are doing. When you have this grid of faces on your screen, it's hard to know who to pay attention to. You're getting all of this information all at once. So I want for parents to both let this be a teaching moment where we realize how screen media can't replicate some of the educational experiences our kids needs, but we've got to just do what's good enough right now. So don't worry about the screen time of being on a screen when your child is participating in a Zoom class meeting or something else that's synchronous. Helping them, giving them the fidgets or the support or the right comfy chair or beanbag or something else that helps them focus and try to pay attention on what their teacher's trying to teach them. And when it comes to other decisions about screen media to keep them occupied, to keep them inside, I really, working with the American Academy of Pediatrics, we've been focusing on positive content. It may be more time than you usually would do, but hopefully we can peel that back when life kind of returns to normal again. And right now, don't feel guilty. It is, parents are basically, saving lives by keeping our kids socially distanced from each other because we're helping reduce community spread. So don't feel guilty, feel like a hero, because this is such heroic work to be trying to take care of our kids and do so many other things at the same time. But focus on positive content. Like I've been experimenting with my kids. Avatar: The Last Airbender has been such a positive thing for my, 7 and 11-year-old boys compared to other shows where they were just fighting afterwards. choosing positive content through PBS Kids, Sesame, that are really trying to address things like racism. They're trying to address things like children's anxieties and fears. This is a really important time to be choosy about content. And then watch together, make it as times where you can talk about it and kind of veg out together a little bit in front of a movie. But don't worry as much about the screens for learning. I know they're not perfect, but if you can create some other hands-on activities, some other social activities where you can, close the laptop or Chromebook and go do something to learn, through experience, is crucial. So the last thing I want to touch on is more severe mood reactions that kids may be having to this time. We only have 5 minutes left, so this will mostly be for Dr. Cousineau and Dr. Marcus, especially tweens and teens. What signs should you look for if they're feeling stressed or depressed? What should you do if you observe this, and what sort of steps to take?
So again, to know that a certain amount, if you look at all human beings right now, and there's a sort of state of alert readiness, which is a green zone, a yellow zone, which is I'm a little bit off, my sleep isn't so great right now, I'm a little more reactive, an orange zone, which is, this is more problematic, in a red zone. Most people on the face of the earth right now are not in green. They are not fully well rested, prepared. A few are. Many people right now, it is normal for people not to be sleeping quite as well, to be having a little bit more difficulties with attention. But when does it become more problematic? I think.
And I just want to say, we got one question about a child developing tics during this time, which is a common stress response in kids, that when their nervous systems are more riled up and under stress, is that it sometimes can come up as tics. It can also be explosive behavior, more repetitive or controlling behavior. So kids express it in very different ways, those different zones that we're in.
Absolutely, yeah, no, tic problems wax and wane with stress. So to have a child who has tic or Tourette's with more tics right now would be completely understandable. But what we're looking for, especially around mood symptoms, are pervasive changes in appetite. So a child who either has a typical appetite and is either carbohydrate craving and eating sweets all the time, or a child whose appetite is turned off. Significant changes in their sleep, so that they're awakening frequently, unable to sleep, have complete circadian shifts, which is not typical for them. Pulling back from their usual activities, so no interest, no pleasure, no desire to do things that have been joyful to them. Either a sad mood or an irritable mood. Irritable moods are frankly as common as sad moods in teens. Again, in a way that's not simply reactive to the parent-child environment or the world, but a pervasive irritability that is uncharacteristic of that child. Any thoughts about not wanting to be around, passive thoughts of death, or actively saying, I don't want to be here, I can't tolerate this anymore, I hope I just don't wake up. Those would all be signals that a child may be developing a mood problem. Those we begin with behaviorally. So again, more exercise, stress management activities. Cognitive behavioral therapy is a therapeutic treatment of choice, as well as medication if needed for those kids. So that would be a starting place.
Yeah, and I would just add, if you're having those concerns or you're seeing those types of behaviors in your child, I mean, that's a really good time to talk with your pediatrician or your family doctor, who can then help you get connected with mental health supports. And so, while we're all learning how to cope with a pandemic for the first time, we in the mental health field have been helping children and teens cope with the hard for decades, and have really good, as Dr. Marcus was saying, evidence-based interventions for these types of things. Many of these services are being provided through telehealth, which is increasing access, which is increasing flexibility in how these services are being provided. And so, certainly there's many people ready to help if your child is struggling a bit more beyond what we all are experiencing right now.
Yep. So it looks like we've come to the end of our chat, and I think we've covered a lot of ground. I wish we could have gotten to all of the parent questions, because they were really excellent. We will try to post some resources, though, to get at some of the questions around masks, about children with underlying conditions. I have some resources around screen time and other alternatives to the kind of online learning that families might want to look at. But it's really been our pleasure to be able to have this conversation and answer some of your questions. So thank you for joining us today. More information and our resources to help navigate this difficult time can be found at mottchildren.org/COVID update for parents. So have a good afternoon, everyone. Thanks a lot.